Good morning. My name is Dr. Barbara Rodwin, and I'm from the Back to Health Wellness Center. I've been practicing acupuncture since 1998, and I've been a chiropractor since 1992. And I actually found with acupuncture, I went and took a year's certification, so I am a doctor of acupuncture. And I found since I've been using it, it's been amazing to help people. I'm just going to talk about the history of it first before we talk about things that I treat with it. So the history, it's been around for thousands of years. So Eastern medicine developed it years ago, and their premise or philosophy with it is that there's actually what are known as 12 meridian systems, and that's what all these little dots on the bodies are. In the 12 meridian systems, 10 of the 12 are named after different organs. So the lung, the spleen, the kidney. Doesn't mean that if you have a kidney issue, we put them into the kidney area. They name them, though, to say that there are problems that intertwine. Years ago, we didn't, as Western medicine, I'd say, believe in it as much, because the premise behind it with Eastern medicine is they say that your chi or your life energy is off, and in order to fix things, we actually have to place the needles into different spots, either in that region if you have a problem in one region, or through different other areas of your body. We've now done, as Western medicine, a number of studies on acupuncture to show that it's very effective on different both conditions and problems. And in a number of hospital settings, they actually have acupuncture there for anesthesiology, and a number of fertility clinics have it in order to actually aid with fertility. They have acupuncturists on staff. So now we are actually more mainstream with it, that people are referring more so different types of healthcare providers. So how it works, when the needles are put in, they're thinner than your hair, and when we do put them in, they're not sensitive usually. One or two could hurt a little bit, but they should, that sensation should ease off. If it doesn't, I do like to, with patients, actually turn it just a bit to release it, or take it out if it's bothering them, because I don't want them lying there the whole time being in pain with it. So as you can see, I just took it out of a package. The packages are closed, and it is sterilized in nature. They're inside a little plastic tubing here for the sterilization with it. And when we do put them into people, what happens is our body sees these fine little things as a threat in a way, and our body sends different types of things that are through the bloodstream and through our different systems to aid with the healing process. And it works quite well with respect to things. With patients, sometimes some people, I could treat the same problem in 5 different patients, and some respond really well to acupuncture, and some they're like, yeah, I don't think it did anything. So I often say try at least 3 treatments with it first to see if it will help you and if your body does respond to it. It's very safe as long as the depth of the needle is put in properly. There are not issues with it. The side effects, there's not normally side effects, again, because especially with pain, I like to actually take it out if one of them is painful, because then your body doesn't go, oh, it's tense there. So there are very limited side effects with it. And sometimes with the acupuncture, what I can do, depending on the problems, is actually attach a machine to it to send a current through the needles. There are wires on it with probes, and the probes go onto the needles, and we can actually send a current in to be able to aid with the healing response. So depending on the problem a patient has, I make the choice if I'm going to put that on or not. So what do I treat with it? I've actually worked on patients with fractures. So if they have a fracture, I often do use the machine and cross it to send a current through to help with the bone to actually re-heal and form properly. And I've used it on a number of different types of fractures, and it's actually helped amazingly well. I think of one patient, she fractured her shin bone, the tibia, and to this day she doesn't have any problems with it. We did acupuncture with the machine, active release, and adjustments to the region, and she's back to her competitive baseball and everything. It's just amazing. I do treat a lot of ankle sprains with acupuncture. I used to use an ultrasound unit before. I do find that acupuncture is a quicker response rate. I have one patient who's a runner, and prior to me actually practicing acupuncture, she had sprained an ankle and sprained it, and it took almost probably 6 weeks with the ultrasound unit to get her back to running. When I did the acupuncture, we did 3 treatments in the first week because she had a half marathon to do that following weekend. She ran it pain-free and was able to attain her goal, and I find it responds just like that as a result of it. I do treat arthritis with it as well. A number of studies have indicated that different types of arthritis acupuncture is very effective for. So rheumatoid arthritis, osteoarthritis, and a number of other ones. I do use it on different joints in the body, joints being thumbs, fingers, wrists, elbows, shoulders, necks, back, hips, knees, feet, toes. So depending on the issue. I do use it on a number of different type of nerve issues. So if it's a disc or a nerve issue being interrelated, so sciatica would be one example of it, the big nerve down your leg. I've used it on nerve issues down the arm or into the neck too. I actually use it with headaches and migraines and jaw problems. Frozen shoulder is another one that I've used it on with rotator cuff problems or frozen shoulder. Contusions being big bruises. So I had a patient once, he actually strained or tore his hamstring from running, and he actually had a big bruise like this, a contusion. And we do what's known as a surround treatment around it, and within 2 treatments the whole bruise was gone. There was a hard spot in the middle that we could get in and do active release on, and he was back to running within 2 weeks. It was just amazing. I also use it with shin splints, knee issues, so patellofemoral, iliotibial band problems. And there are different problems as well if we think of fertility. I've actually treated a number of patients for fertility with it, and you know, with that and a combination of other things, they have been able to get pregnant. Depression, menstrual problems, hormonal issues, sinus issues. I do immune system balancing for some patients that get colds, or if they have times of year where, or a couple times a year where their immune system they know is going to be in a lower point, we do acupuncture prior to it and they don't have the tendency to catch something. So those are a number of different problems. It can be from one gamut, as you can see, to another. If you're wondering if acupuncture would help you, feel free to email me and I'll let you know. Take care.